All right, good afternoon, ladies and gentlemen who are watching at home on RCTV or joining us through Facebook Live. We're doing our weekly update, and we do some spot updates during the week depending on circumstances, but we try and get together with our emergency management team at least once a week. So we know the governor is going already went on, so hopefully he's wrapping up shortly on his end. No major announcements. Last time we spoke, we knew that an announcement was coming soon about schools, and it came. I know the next big announcement is whether or not the stay-at-home order is going to go past May 4th, and we'll talk about that in a little bit. Speaking of the schools, I have joining us by the great use of technology, our school superintendent, Tia Stavell. Tia, how are you?
I'm great. How are you, Brian?
I'm doing, we're doing okay. We're doing okay. I wanted you to be able to provide an update to the residents since we last spoke. The governor did, in fact, I think as we all expected, that school would not be reopening, but education would be continuing. So, Superintendent Stavell.
Yes, so education is definitely continuing. This has been one of the strangest, most difficult things I've ever had to do in my work career. So yes, everyone now knows that schools are closed, but we are continuing to provide the best remote learning experience that we can for our students, and we expect that we'll get better every week. We're learning new things, our teachers are learning. We've got lots of virtual classrooms for our teachers to learn as well as for our students. There are a couple of things that we are still waiting for response from the commissioner on. One is graduation requirements for seniors. So then we'll be able to confirm what the last date of school for our seniors is going to be. We're having conversations about how we're going to celebrate our seniors. There's been talk of parades. There's been talk of sort of individual ceremonies. We don't have a decision, but we will. We know that that's a big deal, and we want to celebrate our seniors. Student Opportunities Act, I've gotten quite a bit of a conversation around that. We are still waiting to hear from the commissioner what that looks like. We have been told that Chapter 70 funding won't be affected, but we don't know what that means in terms of what it looks like on the town side. So we understand and are waiting to hear more about that. In terms of MCAS testing, our 10th graders, our current 10th graders who missed the exam that's required for graduation, the commissioner is talking about possibly doing testing in the fall. And the good news with that is that the results would be back in time for students who may not have done well to be able to make it in time to do the retest. So that's one of the things that we're looking at as well. I've had lots of questions about summer programming, and I really don't have any answers other than to say we are planning on doing summer program. We don't know whether it's going to be face-to-face programming, virtual programming, or a hybrid of both. We're really waiting to see what happens with the situation of COVID-19 and what guidance comes out from the Department of Elementary and Secondary Education. I don't know if you've been told, Brian, did you hear that September 14th is going to be a holiday in the state of Massachusetts?
We have heard. I don't know exactly how they're going to be handling that. So certainly it creates a dynamic for the school department. Is it a day off from school? I guess it would be a yes. So, but we haven't heard anything else about that.
Yeah, we've heard it's going to be a holiday, as will the Patriots' Day remain. So what we're going to have to do is, we're going to wait for the official guidance from the governor, because we've heard from the commissioner, and school committee will have to vote to change the calendar, which will push us back another day. So we'll update the community on that. Our remote learning plan is kicked into gear. We've upped it again with live teaching sessions every day for our students. Some teachers were already doing it. Now it's a requirement for all teachers. Bear with our teachers. Some of them have never done any of this kind of technology work before, but they're getting classes and training, and so we're asking you to bear with us. The students who are doing it love it. I think they like seeing the faces of their friends. and checking in with their teachers. DESE is coming out, Department of Elementary and Secondary Education is coming out with what they're calling their power standards. We're looking to see what those standards are, and those are basically what they want to be priority standards to make sure that kids have learned by the end of the year. So we will see those standards and see if they're standards we've already covered yet, and if we haven't covered them, how do we fit them in between now and the end of the school year. So you'll hear more about that. A couple of other updates. The Family Resource Center, the online kindergarten registration is now open. If you go to our website, you can access the kindergarten registration link. And that process is beginning, and we'll let you know as soon as the regular registration opens. However, for kids who are trying to enroll in school, we are available. Click the link and receive access to FRC staff so that we can get students involved. I think I shared with the community that we had 20 families that we had not been able to get in touch with. We are now down to 7 families out of the district that we have not been able to get in touch with. So what we did was we sent out a survey that went out yesterday. The survey is really for us to just check in with families, see how you're doing. We're asking that you complete the survey. We've gotten back great responses. The majority of our families are doing okay. Of course, we could all be doing better, but they're doing okay. They're taking the learning in stride. They're learning along with their children. Their students are doing okay, but we do have some families that are struggling. We've asked some families to reach out to us, and they have, and we've reached back. And then there are some families that have asked for grief counseling. So this survey is really out there so that we can see what we're doing well and where we can improve. So please, if you have not filled it out, please do, so that we can figure out how to adjust what we are doing. A couple of people have asked, why are we asking for personal information? We normally don't. But in order for us to get in touch with people and to respond, we really wanted to know how our community was doing, and so that our guidance counselors and social workers and psychologists and all of those related service providers who support the social emotional needs for kids can make sure they are reaching out to the families. So the survey is important. Last time I checked, we had over 300 responses, and that's pretty good, having gone out yesterday. So we're going to look forward to that. And I think you have until the 27th to complete the survey. I just want to give a shout out to 2 of our students from the Randolph Community Middle School. They submitted a video to the Massachusetts Health Council that was all about how to end COVID-19 and flatten the curve. There were 8 prizes, 3 awards, and 5 honorable mentions. One of our students received the $100 reward, and another student got an honorable mention. So between the 2 of them, they made $150 talking about reducing COVID-19. So we thought that was a nice big plus for our CMS. The high school has put up a new remote grading expectations. There's guidelines on their website. So if you go to the Randolph Public Schools, click school, and then click Randolph High School, scroll all the way down, there's a blue link that says remote grading expectations. It is really important because the high school is grading very differently, and we have higher expectations. They're older, they should be more independent, and so the expectations that they are following through for graduation competency are there. If you have any questions, please reach out to the principal or assistant principals of Randolph High School. And then a couple of other things I just want to mention. The Lions Project, I followed up to see where we are with that, just because of state funding and everything that's happening with COVID-19. The MSBA funding, that's the Mass School Building Authority, their funding is still intact. They want us to move forward on the Lions Project. According to them, the funding is solid and has not been affected by this crisis. So we are proceeding with the study. We're in the middle of the feasibility study. They're looking at sites, including the Lions, and we are now beginning the visioning process, which is actually going to start on May 7th. And we're going to be looking to members of the community to join us to talk about things that you'd like to see at the new Lions Elementary School. I know there's a question about lockers. People want to know how are they getting their things. Some schools in the understanding that the closure was coming, cleared their lockers. I know the middle school is the school that I've been asked about. We're talking now to figure out what to do. One of the things we're thinking about doing is actually going in, cleaning out the lockers, labeling everything, putting it in a bag, and then almost doing a drive-by where we can bring it to the cars as parents or families pull up. So we'll give you some information on that. We don't think now is the time to invite people into the school. Right now, our RCMS is going through a huge sanitization as if it were summer. Everything's been pulled out, so we really can't have people walking through the building. But we will come up with an arrangement and notify you as to what is going to happen with lockers and how you can retrieve the materials that are in those lockers. And then I just want to give two last reminders. We are still looking for people from the community to be on the Lions School Building Committee. We're looking for people with skills, plumbing, construction, engineering, anything that has to do with a building, anything green space, technology. We're looking for an innovative school. How do we create an innovative school in Randolph? So if you have any interest in that, please reach out to my office. And then a reminder, because we chose to work through this week, which is scheduled to be the school vacation week, the last day of school for Randolph Public School students is June 16th. And that concludes.
I appreciate your update. I do hope that what you're hearing on school funding remains accurate. I keep getting mixed messages from the State House, so your news is much appreciated, and I hope that remains to be the case without a doubt. We're struggling also with summer programming. The summer rec program has been a very popular thing over the last number of years, and we're really struggling with, we don't know the dates of when there's going to be reopen, and we don't know how it's going to happen, what the limits will be on the number of individuals in an area. So it's tough to plan when you don't know those things, and it's difficult. So I hear you on that. So thank you, Tia. I know we'll be talking over the weekend, and have a great rest of the day.
Thank you. You too, Brian. Stay safe, everyone.
Thank you. All right, so we've heard from our school superintendent. At this time, I will ask our Director of Library, Community Programming, and RICC, Liz LaRossi, for an update. Liz?
Sure. Over the past couple of weeks, we've been part of several meetings with the Mass Board of Library Commissioners, the National Rec Service, and the Mass Library System, all to decide what best practices are going to be for when we do reopen. We do not have a reopen date set, but when we do reopen, it will be a phased reopen. We'll have curbside service, printing, lots of precautions, quarantine time set on materials, and lots of other measures that we're going to work with our public health department to work out. We're using this time, however, in both buildings to do some larger cleaning projects as well as some technology upgrades. I know anyone that's come into the library and used our Wi-Fi is going to be really excited to hear about that. It's very, very much needed. The pool and the rink are also getting some much needed TLC at this time. If you don't already have a library card to access free books, movies, music, homework help, job help, etc., there's a link right on the main page of our website. It's super easy to register. I definitely think you should all go register for a library card. May's virtual programs. On Monday, our e-newsletter and social media blast will go out with all of May's upcoming programs for the TFL and RICC. Also exciting is that the Mass Board of Library Commissioners is congregating all virtual programming on one platform for the entire state. So we'll share that out with you as well so that you can see what other libraries around the area are doing. Also, don't forget to keep an eye out on our virtual story times for scheduled guest stars such as Health Director Cody, whose story time is going live tomorrow. We also have a Google Live stream on May 6th at 12 p.m. that will be covering managing your business in times of uncertainty. You can sign right up on the library's main webpage, turnerfreelibrary.org. Next Tuesday, this is a fun one, at 11:30 a.m., I'm going to go live on Facebook from the library to answer your questions while giving a tour of the library, including all of the areas you may have never seen. Did you know that we have a huge basement and it's haunted? Just kidding. Our summer reading program this year. Last year we had several thousand people participate in our summer reading program, and it was all in person. This year it will all be online. We're pretty excited about it, and we're going to have lots of instructions, so stay tuned. Our Senior Olympics that are usually scheduled for May, we have had to cancel. We want to ensure the safety of our seniors over all else, and we are really excited to come back next year with bigger and better than ever Senior Olympics. Our carnival, that's usually at the beginning of June, we are in talks to postpone until late summer or fall, but again, we are just in talks with the vendor, and we'll keep everyone updated as we find out more information. Our town cleanup, we will be getting more grabbers next week and we'll distribute them. If you did not get one and you do want one, email me at elarosee@ocln.org. We're really excited that there was so much interest this year and can't wait to see everybody's posts showing their progress beautifying Randolph. Don't forget hashtag Randolph Pride and hashtag Cleanup Randolph. Some of you have started early and are already cleaning up bags and bags of trash. I'm seeing the posts online. They look amazing. Good job, everybody. Don't forget to distance while you're doing that. Don't meet up in big groups to clean, please. Thank you. In regards to the Resiliency Committee, we have a meeting today at 4 to discuss some future drives and projects. Right now we have seniors being matched with volunteers for grocery shopping. Food pantry and concerned citizens information is being given out to people who have food insecurity. Seniors are being called for check-ins. Masks are being delivered to seniors who need them. And thank you everybody for the elastic donations. If you have more, drop them in the library drop box. Out of this committee, lots of connections and partnerships are forming. We're really excited to be serving our town and ensuring everyone is provided with the resources they need. If you or someone you know needs assistance, please email us at randolphresiliencycommittee@gmail.com or call us at 781-961-0930, extension 113. Thank you.
Thank you, Liz. I do want to mention, and I do have it up on the screen, so RCTV can hopefully show our board to the folks at home. We have a program where we are trying to get cloth masks for our seniors and other compromised individuals in the town. And I think there was a little bit of confusion. We had a resident who donated 200 masks, so thank you to Tiffany Tran. We were placing most of those within our senior housing complex in town. However, we do have some that will be left when we're done because of other donations that have come in. So if you would like to be placed on the list, 781-961-0932, and the email you see there, randolphresiliencycommittee@gmail.com. We do want to continue to do what we can to support our senior population and other individuals with health needs. And if you are able to donate any masks to the town for us to provide to the seniors, same thing, please call or email at those numbers on the screen. I do want to say that the town, for the first week on the face coverings, and it's a face covering requirement, does not have to be a mask. It can be a cloth covering, fabric mask, scarf, or bandana. The goal is to cover the nose and the mouth. Jerry, I'll have you touch base on this. The big thing is, overall, when you think about where we were a week ago to where we are today, there's been a significant improvement in the number of people wearing masks. Depending on the store and the location, some are doing better than others. That said, and we certainly want residents to reach out to us if there is a blatant disregard for the rules. In some cases, we've had people call us and we've gone down there and there's 30 people in the store and there's one without the mask. In a case like that, talk to the store manager versus probably calling us or the police department would be the way to go. However, if there is a situation, we've had a couple, where a business was just having a blatant disregard for the rules, absolutely get a hold of us and we will go down there. We're doing spot checks anyway. Jerry, you've been much more directly involved in this process.
Well, certainly, Mr. Howard, we would get a complaint and we'd go out and make a visit to the store, and especially if it's a store that's already regulated by the Public Health Department and the Randolph Board of Health. We hold their food permit. That's one of the issues that we can have a hearing in the future when things settle down, and that's something that we can discuss, whether or not that food permit would be renewed again in the future if they don't obey a Board of Health order. So this is an order for the mask, to wear a mask covering, some type of cloth covering to prevent the spread of an infectious virus. It's a very serious matter. For those establishments or stores that don't take it seriously, there are repercussions that we can follow.
And we have the ability to fine. So we will continue to gear up our efforts. We are trying to get some other folks to assist us in making sure of compliance. We're going to touch base on that momentarily. I do want to, again, thank Capital Waste for their continued work on picking up our trash and recycling, knowing that in some other communities there have been some issues with getting enough workers. We've not had that issue at this time. But again, please continue to, even if you use a trash barrel, some folks put their trash into the trash barrel without using a trash bag. We prefer that you don't do that anyway, but during this time frame, we really don't want you to do that. Loose trash, napkins, wipes, any type of cloths in or out of the trash cans will not be collected. Please help us keep the employees of Capital Waste safe. So make sure that you're putting your trash in a bag at all times. Somebody asked on the Facebook feed why we scheduled ours at the time of the governor. Well, we actually scheduled ours yesterday. The governor made his decision this morning when he was doing his. So the governor doesn't make a decision until the morning when his press conference is going to be. I wish we had some control on what the governor does, but we're not so lucky. I do want to mention that unemployment benefits for self-employed, gig economy, and other workers is now available. So if you're a self-employed and independent contractor with a limited work history, go to www.mass.gov/PUA. www.mass.gov/PUA. If you subscribe to the town's feed, you'll get email grouping. You'll get that today in the email as a reminder. This is a great benefit for a segment of our population that certainly was being missed. At this time, Jerry, if you want to give a formal report on the Board of Health, that would be great.
Yes, Mr. Howard, thank you. It's been a busy week in the Public Health Department. I just wanted to review some of the statewide statistics for the positive cases. So there are 46,023 that have tested positive in Massachusetts, and 195,076 have been tested. So that's a 23% of those that have been tested are positive. If you recall, last week we gave a similar update, and there were 22% roughly of those tested were positive. So we see an increase in the number of cases. We see an increase in the percentage of those that are not feeling well testing positive. So that's important to remember when we're practicing our social distancing, our hand washing. All of these things are still important to help keep us safe. So in Randolph, we have 353 active cases. And the good news this week, we've broken 101 have recovered. And I want to give credit to our public health nurse, Maureen Disterhoff, and also our community health educator, Peggy Montlouis, who has been actively coordinating, helping us reach out to the folks that are recovering at home to make sure that they have the things that they need, to make sure that they understand what they would need to do to keep safe and to keep their family members safe. And we also have some other partners that I'd like to recognize. We have Board of Health members that are assisting us in helping coordinating our efforts, especially Dr. Zamor and also Dov Yoffe, who's an RN. So since our last update, I also wanted to let you know that our emergency team has been in contact with Manat Community Health Center. They're located in Quincy, Massachusetts. And with the help of the Massachusetts Department of Public Health, they have a COVID response team that we work closely with. Manat is able to test Randolph residents that are symptomatic. There may be cases where an asymptomatic resident may be tested due to circumstances such as being in close contact with a confirmed case. I'm going to provide you with a phone number to call. There are 2 numbers you can call, in fact. The main number is 617-376-3000. I've personally called this number, and the folks that answer the phone are very knowledgeable, and they're receptive, and they're willing to help. There's also a second number where you would leave a voicemail, and this would be 617-404-4133. So Manat already has about 600 customers in Randolph. But if you do call, what will happen is that you'll be asked a series of questions if you would like to be tested. So some of the questions I would just like to review with you so that you know when you do call, this is what they're going to ask you. They're going to ask if you have any fever, chills, cough, sore throat, shortness of breath, fatigue, body ache, loss of smell, or loss of taste. They're also going to ask if you've traveled outside of Massachusetts within the past 2 weeks, which most likely, I think the answer would be no on that one, but they still have to ask. Were you in contact with anyone with COVID, meaning a confirmed case? Were you asked to isolate due to a COVID in the past 2 weeks? So there'll be a series of questions. And again, the best phone number to call to reach Manat would be 617-376-3000. Now, they do have a testing tent. I went there personally last Sunday to see the tent. It's set up, and they also have an indoor facility. Should the weather be poor or be too cold or too rainy or windy, they would be able to conduct the testing inside. Now, I think Manat's going to be a great partner in assisting Randolph. They have additional testing supplies that, through the help of the Mass Department of Public Health, to help service our needs. Now, should you have any transportation issues, Manat will reach out to the Randolph Public Health Department and will work out arrangements to help with transportation to the Manat location. I also wanted to note that the National Guard came to Randolph this week and dropped off supplies such as sanitizer, face shields, gloves, and other PPE like protective gowns for the use of the Randolph Public Health Department. This has been a great source of supplies that we needed, and we hadn't had a resupply in quite some time, so the timing was perfect. Now, you mentioned on Monday we implemented the emergency order to wear a face covering while shopping in retail stores or picking up food from restaurants or visiting grocery stores. Now, this is a face covering. Like I said, it's can be a bandana, it can be a scarf, it doesn't need to be a medical mask. It does not need to be any type of protective N95 mask. A simple cloth covering or one of the homemade washable cloth coverings would be fine. And if you feel as though you have any concerns or you'd like to call us about that, you can reach our office at 781-961-0924. One other thing that we learned this week is that the Community Tracing Collaborative is a group from the Massachusetts Department of Public Health that will be assisting not only Randolph but other cities and towns in the tracing of positive patients to help ensure that other people are not getting infected from that positive person. And the CTC, after somebody is tested and they're positive, they would talk to individuals about how to be isolating at home, and they would also ask a series of questions about who that person may have been in contact with 48 hours prior to being symptomatic. And they also would offer other support services, much like we do. You shouldn't really notice a difference in the call between the Public Health Department and the CTC. We're all working together to help stop the spread of this deadly virus. And finally, we just want to remind you to stay home, wash your hands, don't touch your eyes, nose, or mouth, cover your cough or sneeze, and stay home if you don't feel well. Thank you, Mr. Howard.
Thank you, Jerry. I do want to touch upon a few things. Somebody asked whether or not the saliva test is available in our county yet, and the answer to that question would be, as far as anything I've seen, is no.
I have not heard of any updates about that, but perhaps Manette may have additional information if somebody were to call there.
So I do want to highlight briefly the main items that the town is working on and working with our emergency management team, but also with our elected officials. So one of the top items is funding. Right now, most of the money that's coming into the federal government through the CARES Act is being funneled in such a manner that a community like Randolph gets squeezed out. I'll give you an example that the city of Brockton announced the other day that they received in HUD funds $850,000. Those tend to go to the larger cities. So Randolph is having a similar number based on the 100,000 ratio that the state has determined, but yet because of the size of the community on the other end, they're not matching that in funding. So we're continuing to push. We just got off a phone call today with Senator Warren's office. We spoke the other day with Congresswoman Presley's office. We've been in regular contact again today and yesterday with Senator Timilty's office and with Rep Driscoll. So we are continuing to try and make sure Randolph always gets the short end of the stick when it comes to funding on everything from education down to this issue, because of the size of the community. We have the needs of some of these cities, but they set up the funding mechanism in such a manner that a community our size gets squeezed out, and it's got to stop, and we're doing what we can to try and do something about it. It's getting a little bit frustrating. That said, testing, it was mentioned by our health director, health commissioner, that we do have a relationship. The governor mentioned the other day that he's trying to build relationships with community health centers. So our goal remains to have a pop-up testing center in Randolph. Our goal will remain to have that be the case. However, if they don't grant it to us, and at this point, we've gone from having no option to the Manette Community Health option, which we are very much appreciative of Manette working with us. But we want to bring something locally here to Randolph. We're going to continue to try and do that. And it's very important that if you do not have a primary care physician, if you live in Randolph and you do not have insurance, if in fact you are, whether you're a resident, whether you're a citizen or not, in a health emergency, we want to make sure everyone can get tested. It is critical to ending this pandemic. It is critical to keeping Randolph residents safe. So we are going to continue to push in that area, and that was discussed today. We also mentioned that for those who do test positive, and we give the option of whether to remain at home for self-isolating, they always want to remain at home. I don't blame them. I wouldn't want to go to a hotel room either. That said, when you have multi-generations living under the same roof, it creates issues. Even in my own house, there's 5 of us. So we want to make sure that there is a home kit or a care box that we would be able to supply to residents that are self-isolating, doing the right thing, that has masks, wipes, gloves, hand sanitizer, or information in multilingual categories. In addition to that, I think it's absolutely critical because what they want you to do is go the 14 days as the person who's positive, and then on top of it, you're expected to have the rest of the family go an additional 14 days, 30 days total. I don't think that's realistic. I think that people that are asymptomatic in those instances should be able to get a test so we can clearly make sure that the entire house is not infected with it. Because that's the biggest issue we're coming up with now is asymptomatic residents who feel healthy, but yet they're able to infect others. And that's part of a big reason why we did the face covering. In addition, we have requested additional funds and support to try and assist the police department and our code enforcement officials in monitoring the public implementation of some of our emergency management guidelines, in particular, the masks, also a lot of our fields and the football field, the basketball courts, et cetera. We're also working on the next phase of where we stand with those with food insecurities. We are probably 2 to 3 weeks where we're in reasonably good shape to continue to assist residents, but we know that it's going to come down and crash. The economy is continuing to go in the wrong direction. Folks are not working. Their needs are getting greater between the food pantry, between the Randolph Public Schools, between Liz LaRossi, Jonathan Ramage, and the RICC, between the Randolph Concerned Citizens Group. We've been able to maintain a reasonable level of service when it comes to the needs in the area of food. That is going to continue to be an issue. So that is something we're working with our state partners on so that when the time comes, we're going to be able to do more there. So desperately, those are the big items. We have a whole list even on top of that we've been working on with our state delegation. However, those are the big ones, and I wanted to let folks at home know what we're doing in those areas. Finally, as I will continue to mention every time, the census, please make sure that you fill out your federal census. You go online, and we need those numbers. You just heard me talk about Brockton getting 850,000. Randolph got an extremely small portion of that, and it is all because of the demographic figures that they look at in the census. Fill out your census. If you go to the board, I just want to remind everybody, HyperReach on the town website, right on the main page. You click on that, you fill it out, and you will make sure that you get all of our phone calls and text messages in an emergency. Also, the e-alerts right down here, click on that. You will get all of the emails that the town sends out. And finally, on the main page, at the top in red, you will always have the COVID information available immediately. And always on the main page, we have our information both in Haitian Creole and Vietnamese. So the town's website, it is directed specifically for COVID information at this time. Folks, finally, Jerry mentioned it earlier, we have our masks that we continue to wear here in the building, even though it's kind of a ghost town here in the town hall. That said, we have our masks that we're wearing. We are 6 feet apart at the moment, so we remove them for the show. But do not forget the key component to this: wash your hands for 20 seconds, warm water. That is a critical way to ensure that you can try and not pass this virus. I want to end this week as I have every week. Folks, this is getting difficult, no question about it. We're best case scenario, May 4th, some of these restrictions may be lifted. I don't believe that is going to happen with the governor closing daycares until late June. I do think that there will be a slow open. So I know it's difficult when you have family members at home, especially the students who want to go out and they want to see their friends and they want to exercise and enjoy it. It's just, we've got to keep our eye on the prize here, folks. We've got to do what we can to socially distance. It is critical. So please take care of each other. Be well. If you have masks to donate, please reach out to myself or Liz. We have seniors in town who are desperately seeking them. Thank you, and be well.